STD transmission. Direct transmission, exchange of body fluids. Indirect transmission, least likely transmission. External contact, skin to skin. Formite transmission, contaminated public toilets, showers, etc. Digital transmission, spread from infected area to other parts by person's hands, such as touching. An example of this is syphilis.
Syphilis. It's a pathogen, spiral-shaped bacterium, Treponema pallidum. It affects 20 people out of every 100,000. It occurs in 3 stages: primary, secondary, tertiary, or late syphilis. Primary syphilis, canker, a painless sore, begins as a small red bump, becomes an open sore that oozes fluid, forms at the part of the body where infection occurs, 10 days, 3 months.
Secondary syphilis occurs 2 to 8 weeks after canker heals. Some symptoms are rash, usually on the hands and feet. It doesn't really itch, but it may or may not be transmitted by skin-to-skin contact. It could go away without treatment in a few weeks, but you should probably get treated for it. Latent and tertiary syphilis. Latent syphilis has no signs or symptoms. Tertiary occurs 15 years after the initial canker. Affects the brain and spinal cord, which can lead to mental inflammation of the aorta in the heart. Can also cause blindness and paralysis, or being paralyzed. May cause death. Syphilis additional info. Diagnosis is a blood test or sample from the canker, which contains the spiral bacteria. Some treatment is penicillin, but it cannot cure the permanent damage caused by tertiary syphilis. An infected woman can pass syphilis to her unborn baby.
How can I reduce my risk of getting syphilis? Only way to avoid STDs is to not have sex. If you are sexually active, you can do the following things to lower your chances of getting syphilis. Being in a long-term mutual monogamous relationship with a partner who has been tested for syphilis and does not have syphilis. Or using latex condoms the right way every time you have sex. Condoms prevent transmission of syphilis by preventing contact with a sore. Sometimes sores occur in areas not covered by a condom. Contact with those sores can transmit syphilis. Now, are you at risk of syphilis? Any sexually active person can get syphilis. Have an honest and open talk with your healthcare provider and ask whether you should be tested for syphilis or other STDs. All pregnant women should be tested. You should get tested regularly for syphilis if you are sexually active and/or are a man who has sex with men, are living with HIV, or having partners who have tested positive for syphilis. Thank you.
Also, stay abstinent.
Please.